it's very important when you meet with your physician to have that frank and open dialogue about your bladder tumor. What are your hopes? What are you looking for with your treatment? What kind of side effects do you find most threatening or most scary, or the ones that you hope to avoid? What side effects do you have currently? And what type of therapies can your physician help you find that will help you undergo treatment successfully and not exacerbate your underlying medical conditions? Treating cancer in general now compared to 20, 30, or 30 years ago is very, very different. We have better anti-nausea drugs so patients can keep their nausea under control. We have better treatments to stimulate blood counts and decrease the risk of infection. So talk with your physician. What are your fears? What is keeping you from considering treatment for bladder cancer? Usually, with that discussion, we can find a treatment that will be effective for you and also help find additional therapies to overcome side effects that you may find concerning.
Any relationship between a patient and their physician, but especially when it comes to a cancer diagnosis, I think is a partnership, right? Because I could do everything that I know how to do, but if the patient is not an equal partner in his or her care, it does not work. So a frank discussion about that at the first meeting itself is very important and something I do all the time. And it's not just when it comes to surgery itself, because obviously surgery is a major step, but it comes to treatments, whether it's intravesical treatments of medication in the bladder, whether it's chemotherapy where patients are losing their hair and having neuropathy, whether it's some of the more targeted therapies that we have, of course, in our armamentarium where the side effect profile is extremely different. If the patient's not an equal partner in his or her care, then the battle is not as easy to overcome, essentially.